hours nationally, we've had 47,738 cases reported, which is an increase from about 38,000 cases yesterday. 2,362 COVID cases are in hospital, which is almost double the number that were in hospital last week. But 184 cases are in intensive care, only slightly up from last week, which was 135. And of those, 59 are ventilated, and that is steady. So we haven't seen an increase in cases in intensive care that are ventilated. So as usual, we're working collaboratively with the states and territories, looking at the data, particularly with respect to hospitalisations. And there's some early evidence that the majority of people in critical care have the Delta variant, particularly in jurisdictions such as Victoria. There still remain a significant proportion that aren't fully vaccinated and or they have other serious illnesses or comorbidities. And also some interesting evidence that a lot of people who are in the hospital wards, not intensive care, but hospital, have gone to hospital for another reason and tested positive for COVID. And that's not surprising given the sheer case numbers that we're seeing in the community. So that's both. We do know that the Omicron variant is inherently in itself a less severe virus, but it's also part of the outcome of our excellent vaccination coverage, double dose vaccination coverage here in Australia, that we're really seeing limited severe disease despite those significant case numbers. But, talking about those significant case numbers, they do continue to rise. They are large numbers that we've never before seen in Australia. I think at this point, we all know somebody who's either got COVID or we've got co-workers off work because they're quarantining or isolating, or we've had events cancelled, and other impacts in our daily lives that are occurring because of the sheer case numbers. So it really is time for all of us to play our part in managing those numbers and helping them stabilise and come down. And we do that through our behaviours, COVID-safe behaviours, which we're all aware of. But more critically, we know that the booster, whilst double-dose vaccination prevents or protects against severe disease, the booster is much more effective at preventing against infection, getting infection. And so I'm really pleased today to be able to say, and General Fruin said it this morning, that as of today, another 8 million Australians became eligible for a booster, having had completed their primary course 4 months or more ago. We've already seen 2.5 million Australians have their booster, but with another 8 million eligible today, that's really exciting news. I know my husband's excited. He's getting his today. And then on the 31st of January, another 16 million people become eligible for their booster, which will probably be the remainder of people eligible, although there might still be a few who have to wait a little while. So I think it's incredibly exciting that we have enough supply of vaccine. There's plenty of supply. People are becoming eligible today and will continue to become eligible over the month of January, and really would encourage everybody to go and get their booster. Make a booking either with your GP or look online at health.gov.au. If you Google that, it's the first thing you'll see, book a vaccination, and get your booster, and then we can all play our part in really bringing these case numbers down and reducing that impact that it's having on everybody's lives. Further, I guess, to the vaccination program, I know everybody's aware that also the 5 to 12-year-olds, as of the 10th of January, that vaccination program will also commence. So for parents who have already decided to get their child vaccinated, please consider making a booking as soon as they open. Or if you're still considering it, then please discuss as well with your vaccination provider about having that done. So with that, I'm happy to take questions.
Dr. Bennett, you mentioned the national case numbers just before, but we're seeing positive test rates of between 20 and 30% at the moment around the country. What do you think the real case numbers could actually be at the moment?
I think that's a very good question. So a little bit like the data's not entirely telling us what's happening. I think that's fair to say. And as we said in hospital, the numbers we're seeing, people actually being hospitalised for different reasons and happen to have COVID. There's certainly many more cases of COVID out in the community that we're not aware of. That's not necessarily a bad thing. Because I think generally where we're seeing COVID is in younger people. It's very mild. Many might not know they have it, or it's just a sniffle. So they're not overly unwell. and it does mean then you get a natural boost from that in the population, and it also would indicate then if there are more cases we don't know about, then the impact on the system is even less than we anticipate now. So I think that's certainly the case, and given the case numbers, it's not unusual when a disease is as widespread that happens. It happens in flu every year. We don't get complete cases of influenza every year. We get a proportion of people who get tested, and from that we extrapolate as to what sort of context or influenza season we're seeing.
Isn't part of that problem the issues we're seeing with the testing sites across the country? And can you give us a view as to why that is problematic, if it is, and if it's not problematic that people aren't getting tested and we don't know the full extent of COVID in the community? Do we need to change the rules for who gets tested, when and why?
I wouldn't be confident to say that the reason we don't know all the cases in the community is because people can't access a test. So I do acknowledge at the moment there are delays to testing. We are seeing queues, and people might have to look around to see where they get a test. National Cabinet last week discussed testing of cases and contacts, and that was revised to accommodate really testing those most at risk. The most important thing for people is if they're feeling unwell, they should stay home if they're unwell. Now, if you need a test and you're a close contact, you'll be informed of that either through the case or the public health authorities, and you should certainly seek to get a test if you're advised to do so, and those tests are available from what I'm hearing. I haven't heard that nobody's able to not get one. It's just a bit of a delay more than usual. Now, with the revised testing and isolation criteria of National Cabinet, that will free up testing in the clinics with the PCR testing, and with more rapid antigen tests becoming available very shortly, I think that problem will be solved as well. This is a problem that we're seeing around the globe. I think the sheer increase in numbers with Omicron, while everyone knew it was more transmissible, it's happening very quickly, and but testing is accessible and will become even more accessible very shortly.
You mentioned there the kind of global pressure on testing, and there's certainly global pressure on rapid antigen test supplies. Do you have any idea when Australia is likely to see more supplies of rapid antigen tests through the tests ordered by the federal and state governments as well as private companies?
So the rapid antigen tests, they are still accessible now, not to everybody, I acknowledge, but they're continuing to come in, and over the next week or so, I think the government announced it earlier, we certainly should see upwards of 100 million rapid antigen tests coming into the country. So we'll have plenty of tests for people to access as they need. But right now, people who do need testing can get it. There are different avenues to get that through, obviously. But the most critical message I'd have is, if you're mildly unwell, stay home. If you're more moderately unwell, then you should seek healthcare. See your healthcare provider, and whether that's your GP or going to hospital, and certainly tests are available there as well.
Today, the FDA approved boosters for everyone aged 12 and up. Has the TGA received any applications yet from vaccination providers for boosters for teenagers?
Look, that's probably a question for General Fruin or Professor Skerritt, so I can't quite answer that. I think as companies, if that's happening in the FDA, I've got no doubt that those providers will also look for approval in Australia, and the TGA will go through its normal processes at looking at those, and then they'll progress as appropriate and as able.
Dr. Bennett, sorry, just on the issue of the rats. So I know you say that they are available, but there are widespread reports that people can't access them. They are not available through the private market. The AMA has called this a market failure, and the government was wrong to rely on the private market when the government strategy was discussed in September last year. So why aren't those supplies on the shelves now? Isn't it a failure of the Australian government not to secure those supplies earlier?
No, look, I don't accept that at all. I think the context in September was very different. If you remember, we were dealing with the Delta variant, and so there'd been a lot of planning around the Delta variant. There'd been modelling to indicate what sort of numbers we could expect to see at various levels of vaccination. as the Australia reopened and people started to live their daily lives. And so we're in a very different situation now, a very different context with the case numbers we're seeing. And there's a lot of work, there's a lot of people working to ensure that supply is secured as quickly as possible, and that will certainly occur in the next few weeks.
And so through that planning process, there was no discussion or modelling done about the possibility of a more severe strain of the virus and testing demand going up?
That's always been on the table, and again, I'd say that every country's dealt with this situation. So you always plan for various options. You can't act on all of those various options though, because you can't predict which pathway that will take. So there was certainly planning done, which is part of the reason I think that governments have been able to act so incredibly quickly. I mean, even in countries that had rapid antigen testing in place in a widespread way because they had more cases, have found it difficult to increase that availability of testing exponentially with Omicron.
So can you just explain to us, and the AMA said that the response that the department gave them at that time was that it would be the government didn't want to intervene in the market. Greg Hunt said in a press conference in October that the government's approach was to let that market develop. Can you please explain to us why the government decided to take the sort of market-based approach rather than securing public supplies?
No, I don't think that's really a question for me. All I can do is, as I said, I think from a policy point of view of the rapid antigen tests and their use case, certainly the Communicable Disease Network of Australia and the Public Health Laboratory Network, both subcommittees of HPPC, have always had a testing strategy in place, and that's been published, and that included use of rapid antigen tests as policy questions. So they don't consider the market issues in that, so it's probably not a question that I can answer.
The AMA says it was departmental officials who gave that advice, that it was...
So perhaps it needs to go back, that question needs to go back to that person.
Okay, so from a health perspective, without the availability of rats currently, and even the suggestion that people who are unwell don't necessarily need to go and get a test, doesn't that put further pressure on the hospital system if people are unwittingly transmitting the virus or going to see vulnerable people without realising they are indeed positive cases? Wouldn't it be better to have those rats freely and readily available to people to ensure that they're not, that there is a limit on those infections?
Well, I think what you're talking about, if people are visiting vulnerable people, we have to assume that they're otherwise well and they don't need a test. So I think we've always encouraged people, certainly if you've got symptoms, you should be staying at home and not visiting vulnerable people. Anyone at the moment, there is a policy out of National Cabinet, and that's published as a who should be testing and how you can access those tests. I think for the general public, if you don't fall into any of those categories, and I think this is what you're saying, and if you want to double check to make sure you haven't got Omicron, as we know it can be mild before you go and visit vulnerable people, that's where some people are having difficulty, I think. And so over the...
Isn't that a problem? Isn't that going to compound the pressure on the health system?
Yeah, so people need to make their choices though. I think that if they're concerned that they're not well and they're visiting and they've got holding a party or visiting vulnerable people, then they just need to make a decision about that. And I'd suggest that, if you've got any concern that you might have COVID or any virus for that matter, that you not visit those people to protect yourself and them, and that you stay at home.
Beyond visiting just elderly relatives, though, there are people who work in areas with vulnerable people beyond, hospitals and doctors' clinics who may want to take or need to take a rapid antigen test for work, say people who work with homeless people or those sorts of things. And charities are saying that they're now spending tens of thousands of dollars buying these rapid antigen tests. We still don't have a full plan from the National Cabinet on how rapid antigen tests should be used around the country. How soon do we need, do you think we will have that plan, and do you think it will address some of those issues around access for those charities?
Well, National Cabinet meets again tomorrow, and I'm sure they'll be considering that. I mean, the use of all testing, both PCR and rapid antigen testing, and the range of measures are under constant review and consideration with the pandemic context. So I'd expect, any new information will be out shortly. I think it's important, though, to remind people the most important thing that you can do is to get vaccinated and now have your booster. So getting vaccinated protects you against severe disease. Getting your booster will protect you against infection and transmitting to others. So for workers, all of us, the community, I think that's the most important thing we can do. to protect ourselves and others. And again, the second most important thing is if you are unwell, then you do need to stay home and certainly seek, I'm not saying don't get tested, I'm saying seek access to a test. I just don't want people to be anxious if they can't get a test immediately, because regardless, the most important thing they can do in that situation is stay home until they're able to find a testing centre.
But it's not ideal, is it? I mean, do you see the current situation as working as it should be when people are trying to access tests and can't?
Well, I think it depends what you mean ideal. So eventually, as for flu, as I said, we don't test everybody who's unwell. So we will, over time, pivot, even with COVID, to managing it as it's endemic, like a normal virus. Now, that will mean people who are unwell stay home. If you feel if you're moderately unwell, or you need to think you need to access healthcare, you see your GP, or you present to hospital, or you ring 000 if you're very unwell, and then you get tested. Most people with endemic viruses will only get tested when they access healthcare. That's not where we're at yet with COVID, so at this point it may not be ideal, but it's not case numbers particularly that we're worried about. We are worried about the impact on the health and hospital system and critical care, making sure that everybody can still access the health care they need and primary care, and also modifying our own behaviour so that we can bring these case numbers under control, so that we can limit the impact which we're seeing in our daily lives, not just the health system. As I said, we all know someone with COVID, there are people off work, there are things being cancelled just because of the sheer numbers that we're seeing, and because people are then doing the right thing and staying home when they're unwell.
You mentioned boosters as a really important factor in protecting ourselves against Omicron. Supply is certainly not an issue at the moment, but workforce seems to be a problem. How are we going to vaccinate millions of people in the coming month with these workforce issues? What are some of the solutions there?
Well, it's not a problem that I'm aware of, so that needs a solution. I think there's a lot already in place that the program's had in place, from the double dose vaccination. There's any number of avenues that people can access their booster, so depending on their preference, and that's including through pharmacies, their primary care physician, state-run clinics, GP respiratory clinics. Supply is not a problem. If you find your preferred provider is not available, as I said, you can go online to health.gov.au. It's the first thing on the front page, and you'll be able to access a list of sites that you'll be able to get your vaccination. I might just ask, there's on the line, any questions?
Oh, yes, thank you. So just to clarify, you mentioned before 8 million people eligible today, 16 million by the end of the month. Lieutenant General Fruin said 4 million today and 8 million by the end of the month. Can you just clarify the numbers there? Thanks.
Well, my information is at 8 million today, so I will get back to you with that, if you like, just to completely confirm.
Sure, thank you. And in terms of distribution of boosters, how are you going to be managing distribution of those to meet this uptick in demand? Are you readjusting given the increase in demand thanks to Omicron?
Yeah, well, as I said, as the program has had distribution mechanisms as well as, provider mechanisms as well as supply in place for some time, and the planning for the booster has been underway for a while. Again, it's probably a question for General Fruin, but the distribution chains are all in place, and some of those included continuing deliveries over the Christmas period, including public holidays, and I'm sure now with the opening of the booster program to more eligible Australians today, that distribution will ramp up.
And just in terms of the healthcare workforce, because obviously, we're hearing these reports of healthcare workers saying they're burnt out, they're exhausted. Are they going to be able to cope with the concurrent pressure of cases, of demand for vaccines and for testing? So with the vaccine program, as I said, I think certainly at the beginning of the vaccine program, that fell on healthcare workers were primarily providing the vaccination, but there's a range of avenues now that people can access vaccination, which also frees up healthcare workers in hospital settings to do other things. As you say, it's been a very busy couple of years, and I think we would all acknowledge that the health workforce generally is very tired, but they are resilient, and there are plans in place. I think it's one of the reasons that we're monitoring hospital capacity so closely, and there are plans in place to cope with surge wherever it may occur and support those.
healthcare workers. I mean, we also have to remember healthcare workers are part of the community. So we're also seeing healthcare workers get COVID, not necessarily at work, but in the community, and that puts that added strain on the health workforce as well. And so there are considerations which you will have seen in the media around healthcare workers who are exposed to COVID, potentially but low risk, being able to work under certain conditions, just to balance that the impact on the workforce to ensure that health service delivery can continue with transmission risk of COVID. And obviously healthcare workers were really the first to be vaccinated, one of the first groups to be vaccinated and the first to be boosted as well.
Dr. Bennett, I might just jump in. It's Madura from the Courier Mail. In terms of rapid antigen testing, is there modelling being undertaken to estimate how many RAT kits will be needed per day in Australia, in line with how quickly case numbers are expected to rise in the next few weeks and months?
I'd probably take a step back from that and say there's certainly consideration of looking at the case numbers we can expect in the next few weeks and months. Once that occurs and we know case numbers, then the considerations that are underway, which we discussed earlier, around where rapid antigen tests will be used, that National Cabinet will consider, would be more meaningful. But there's also the issue of, as we know, even when we were talking about not knowing the full extent of cases out there, and often when people take a rapid antigen test, that doesn't become visible to us either. So there's a range. What's most important is really monitoring that effect on the hospital system and critical care, and understanding the numbers that we might need to see for a range of measures, one of which is testing, but also the other public health and social measures that we've used throughout the pandemic really to manage it.
Is there work being undertaken to make those rapid antigen test results visible to authorities? It is visible in other countries, or there are mechanisms to do so. Would that be useful?
Yes, I think all of those things will be under consideration, and there are ongoing discussions with the Chief Medical Officer and Chief Health Officers around the country. We learn clearly from overseas as well as learning from each other with the states and territories. So I imagine that would be part of the discussion and deliberations around rapid antigen testing more generally.
There are a handful of private pathology testing sites closed in Queensland today, apparently due to the Commonwealth engaging those pathologists to undertake surveillance testing at aged care facilities. What's the policy at the moment around surveillance testing in aged care facilities? And is there enough rapid antigen tests in the government bank, I guess, to go around for that purpose?
So surveillance testing in aged care facilities has been in place for some time, pre-Omicron. The need has obviously increased, and private providers are a part of that, and not just surveillance testing, but clearly we are seeing a number of outbreaks in residential care facilities, and private providers have been involved also in doing the testing in that space, because as you'd appreciate, it is critical in outbreaks in vulnerable settings like aged care that testing is undertaken. So that is occurring. In fact, it's been increasing in other jurisdictions over recent weeks. As we know, it's with New South Wales and Victoria have had cases for a prolonged period of time, but the other states are really just seeing their rise in cases. And there is a nationally coordinated approach to surveillance testing in residential care facilities. Yeah.
Dr. Bennett, just on testing, because the testing regime was, set up based on modelling of other variants. Omicron is obviously much more transmissible. Have you commissioned new modelling to inform your planning for this current strain? I don't commission modelling, so the department does, as does a National Cabinet. And so, as I said, there's been modelling under consideration about Omicron. To do the modelling, you really do need to understand the virus itself, and that's only becoming more apparent more recently. So how much more transmissible and how much less severe it is than the Delta variant. Clearly that's something that we understand more now than we did even 2 weeks ago. And so I think certainly modelling will be under consideration as to what modelling we need to do to further inform this outbreak. But we know what we need to do now. And so modelling just tells you generally what you should know or what you think is going to happen.
It's really then what you do about that is important. And so National Cabinet, as you know, met last week. The testing, tracing, isolation and quarantine settings were reviewed, given the sheer case numbers. That doesn't mean, though, that if people are no longer required to quarantine, that doesn't mean that they're no longer at risk of getting infected. So it comes back to all of us to think about what we can also do, and that is around our behaviours, including, avoiding crowded indoor settings if you can, wear a mask if you can't, make sure that you're, consider having your booster now if you're eligible. We've certainly already got great vaccination coverage rates, so it's really about all of us working together. We know enough about this virus and where it's going to go, and we have to act now, but certainly modelling will be part of that. But these case numbers are increasing quickly. What we're seeing around the world is that they do have short, sharp rise, and then it does plateau and fall off. And so there are things that we need to do now, that we can do now, to work together to bring those case numbers under control. And I just like to reiterate that the booster program is probably the single most important thing that we can all do.
When are you expecting it to peak?
Dr. Bennett, just one more, if I may. Is it safe to say that we can expect a surge in COVID-19 case numbers when children go back to school? And how critical will, parents sending their kids to get that first dose if they're aged between 5 and 11 to slowing the spread in that cohort?
As I said, the vaccination program for 5 to 12-year-olds starts on the 10th of January. So that is time for children to get their first dose before school. But as you say, school will commence before children complete their dose. But what we do know about children is they generally do have milder disease. So we may well see an increase in case numbers in children, but they have milder disease and they are less likely to transmit to others. They often get it off adults. And so that's not to say they won't transmit to others, but they're less likely. So we expect to see a rise in cases. And it's really just reverting to the importance of getting vaccinated. There are plans in place to manage cases in schools and outbreaks in schools that the jurisdictions have in place, that are put in place, and they will enact when they need to. I think we'd all agree that education is critical for children. And so it's very important that we keep schools open and we put measures in place to protect children and teachers when schools are open and they're at school.
When do you expect this current wave to peak?
Well, I think if I had the answer to that, I'd be very popular. So I think what we're seeing overseas is that, certainly in South Africa, it was really 4 to 6 weeks that they had their wave. But we have to remember the context in other countries is always very different to the context in Australia. So they'd had previous waves, a higher level of natural immunity, lower level of vaccination coverage. But I do think that, by February, we will probably continue to see cases increase over the next few weeks, but by February I'd expect, with the booster program in place as well, that we should see a plateauing and a cases starting to come down. So, thank you.
Oh, sorry, just a few more questions.
Oh, sorry, I've been told that's the last question.
No,
Sorry.
So it's hard. No problem. So just on hospital capacity, are you confident that emergency departments are going to be able to continue providing services to all Australians, with hospitals saying they're under stress right now? Some are even saying they're under extreme pressure.
So the jurisdictions, the states and territories are saying they're confident of their hospital capacity and capability and their plans in place. So it is a question for them, and I certainly listen to their answers around that. I think what we would say is encourage people to seek healthcare if they need, but if they're mildly unwell and they would otherwise stay at home and they're comfortable at home, then they're able to do that. So I think with plans in place, primary care is being supported as well to care for patients in the community. There's the National Coronavirus Helpline. There's a range of avenues for people to access information, talk to somebody before they present to emergency department if they don't need to. But it's most important if people feel they need emergency care, they present. But if they've got questions and they're otherwise mildly unwell, there's a range of resources that people can access. Again, if you go to and click on the resources tab. Many are there, but there's the National Coronavirus Healthline as well. So we'd just encourage people to, manage their requirements in that way.
And just lastly, several social media groups have popped up in Tasmania and around the country. They're taking it into their own hands to list COVID exposure sites. They seem to be reacting to a lack of information from their state government about where COVID is spreading in their community. Are there concerns about communities taking listing sites into their own hands?
I think that, if communities feel comfortable doing that, then they're able to do that. I think from a public health policy point of view, where we're heading and what everybody needs to expect that they'll be exposed to COVID at some stage. So that was part of the reason for the pivot that National Cabinet did to looking at more high-risk contacts, which means those contacts more likely to get infection with a higher degree of exposure, so household and household-like. I think if you're not identified as one of those, it doesn't mean you're not at risk of getting it COVID. You may be exposed anywhere, and I think some people feel comfortable knowing where they might have been exposed, but really we should all be expecting we may be exposed and continuing to monitor ourselves for symptoms so that we can, manage ourselves accordingly if that occurs. Thank you.
Thank you.